It's a very easy, it's a one-sided form. It's very easy to fill out. You just need to write the doctor's name, the resident's name, date of birth, address, health card number, the date you assess them for their initial assessment. Based on today's assessment, the resident shows the need for the following. Check it off. You can write little details if you want. If you add information, it'll just look better for you and the doctor will be more impressed. Then you can just check off here what you're doing for the physio treatment plan and fill in the bottom. If you have any questions about the suggested treatment plan, please contact me. Print your phone number, your name, your signature, and the date that you complete the report. Fax this off to the doctor as soon as you can after your initial assessment. That way you're keeping in good communication with the doc. So they're signing the referral for you. You're going to do them a favor by sending them this for their chart. Later on, you're going to need to send them the 85th visit form to sign and get back. If you send them updates on their patients, our residents, every now and then, they'll be more apt to sign those forms back to you because they'll know you're keeping them in the loop of what's going on with their patient. So you can either, if the doctor actually comes to the retirement home, you can leave a copy of this for the doctor. If you're in a community home or a retirement home where the doctor does not come to visit on a regular basis, I would suggest faxing it off to their office. And again, similar to the initial assessment report that we just went through, this is the in-home physiotherapy progress report, and this is what it looks like. And pretty much it's the same information as on the initial assessment report. However, so the same information at the top. The top part here says, to date, the resident has shown improvements in or maintained ROM, chest condition, pain control, strength, walking, balance, transfers, or other. What I do when I fill these out is because in some things the resident may have maintained their status, and in other things they may have had improvements. So if they've had both, I'll, for example, circle improvements, and then I'll circle balance, and I'll circle strength. And if they've maintained range, I'll underline the word maintained, and then I'll underline the things that they've maintained, just to show the difference that they've had some improvements and some things maintained. You can write little comments here. If they have had improvements in range of motion, you may want to make a comment that pain-free shoulder abduction is now full, or something like that. If it's about balance, I'll often on the right-hand side, I'll just say Tinetti score improved from 19 out of 28 to 24 out of 28, which is low risk of fall now, or something like that. I'll comment on their tug score, their unipedal stance score, whatever it may be. The next section here, the resident shows continued need for attention to the following. It's the same 6 categories. You can check off, you can add little comments, strength, especially leg strength, or especially shoulder abduction strength, or something like that. If it's balance, you may want to write especially unipedal stance with eyes closed, or something. Then you have the physiotherapy treatment plan. So because we started the initial assessment treatment plan, we had to add all these things onto their treatment plan. Now you're either continuing something from previously, or you're adding something new. And then you can specify it here. I'll often write the frequency, 3 times a week, or something like that. And then if you have any questions, again, print your phone number, print your name, sign your name, and the date that you complete the report. Same thing as for the initial assessment report. If the doctor visits the retirement home on a regular basis, you can leave a copy for him. Keep a copy for your own file as well of this and the initial assessment report. If the doctor does not visit your home because you're in a community home, or it's a retirement home where the doctor for that resident does not visit regularly, just fax a copy off to his or her office. So as you know, for all of our residents, whether they be in nursing homes, retirement homes, or community setting homes, all of our residents are guaranteed 100 visits. The OHIP fiscal year is from April 1st until March 31st. So when April 1st rolls around, the resident has 100 visits as long as we have a signed medical referral, or in a nursing home a signed referral by an RN. They're allowed those 100 visits, no questions asked. Many of the residents that we work with, I would say the big majority, do need extra visits, and so the ministry has allocated an extra 50 visits that the residents are allowed to have, as long as the physiotherapist can show objective proof for the need for those visits. I would say in most cases all of our residents would benefit from those extra 50 visits, which gives them a total of 150 visits per year. When you're looking at 150 visits per year, it's basically 3 treatments per week for the entire year, with the exception of a couple of weeks. Some of our residents may need care Monday to Friday if they're on a walking program or on a chest physio program, or if they've had a hip fracture and they're back from the hospital, or they're a new resident. They may need 5 days a week care for a certain amount of time, and that's okay. Even if they're on a walking program and they have daily walks, like Monday to Friday walks, 5 times a week for the entire year, it's okay. We need to give them what they need. However, we're only paid for 150 visits. So, once we get to 100 visits, no questions asked, we have to have certain paperwork in place in the residence chart before that 101st visit is billed to the ministry. In the past, we used to have to submit that objective proof to the ministry, wait for them to approve the extra 50 visits, and send that approval back to us before we could continue treatment with the residents. It was a ton of paperwork. It was long waits for residents. The ministry saw that it wasn't the best system, so what they've said now is, as long as we have the paperwork in place before that 101st visit is billed, or that first extra 50 visits, then it's okay. So we have to have the paperwork in place before we bill that 101st visit, or that first of the extra 50 visits. That paperwork is all within this form that's called the Physiotherapy 85V for 85th visit summary and referral form, and this is what it looks like. It's a one-sided form. Basically, we have the top part of the form up to the grayed area here. So all this top part of the form is the objective proof that we feel the resident needs continued physiotherapy, and the new referral, because we need to get a new referral signed for those extra 50 visits. This is easy in a nursing home, because once the form is filled out at the top, we can just ask the RN to sign the new referral. This becomes the new referral that's in the residence chart as the new referral. In retirement homes where the MDs visit regularly, it may not be so difficult. However, not all doctors visit the homes regularly. In community homes, they don't really visit all that regularly either. So in retirement home and community homes, there is going to be a need to fax this referral, this summary and referral sheet, to the doctor, and it cannot be a nurse, it has to be the doctor, for him or her to sign it and fax it back to us. Let's just look through the form here for a moment. So at the top of the form, again, we have the resident's name, perhaps their room number, date of birth, health card number, the name of the physiotherapist, and the date of the reassessment. The reason it's called the 85th visit form when they're allowed 100 visits is because we want to have some warning that the 100th visit that they're allowed, no questions asked, is coming forward. And so Colago, when the 85th visit is billed to the ministry, Colago will send an email to support office and to the physiotherapist who's the billing physiotherapist for that resident. Even if the PTA is the one entering their stats and the treatment is billed and it's the PTA that does it, it'll go to the physiotherapist that the treatment is billed under. There's a warning email that is sent to the physiotherapist and to the support office saying this resident just had their 85th of 100 visits. You'll see it in the subject line. You have to open the email to see the date that the resident had that 85th visit. The PTAs are usually the ones that keep track of this, so I would ask when you open that, because the PT or the support office may be forwarding those emails to the PTAs, when you open your email, just write 85V December 1st. That way you have a record of when the resident had their 85th visit. Just write it at the top of the form. Then you take this form, the resident 85, 100, 150 visit tracking sheet. This is what it looks like. It's the same on the front and the back. When you open that email and you write the date on top of the summary and referral form, you then write the resident's name on the tracking sheet and the date of their 85th visit, which is inside the email on the first column there. You would then alert the physio to the fact that they have an 85th visit form to complete. The physio takes this form. They're going to look and see, okay, the resident had their 85th visit on this date because the PTA has written it at the top. In a nursing home, they'll look at their RISE schedule. In retirement and community homes, they'll look at their resident reevaluation sheet, the tracking sheet, to see when did they last reassess the resident. If you've seen the resident within the last 3 weeks of their 85th visit, why not use that last reassessment to fill out this form? Now, don't just say see reassessment dated whatever here. Actually fill this out, because we need to have that objective information on this form according to the ministry guidelines. So you're going to fill out their range of motion and strength, their cardiopulmonary system, any Tinetti, ambulation, tug, unipedal stance, 3-minute walk test results. You're going to fill out what they've shown improvements in or maintained, what they have continued attention or need for attention for, and what the treatment plan is. Okay, so you're going to fill this out. Again, if you've seen them in the last 3 weeks from their evaluation, their 85th visit date, you've seen them 3 weeks within that date, you can use the information from that assessment to fill out this form. If you have not seen them, let's say it's been 2 months since you've seen them, you'll have to go see the resident again and just do an 85th visit assessment to be able to fill out this form, to get it faxed to the MD if you're in a retirement home or a community home, or to bring it to the nurse if you're in a nursing home, to get the new referral signed, which is just the bottom part here. Okay. If you see that you get the 85th visit, it's December, well, let's say December 1st, that you get the form, that they've had their visit on December 1st. If you see that you're due to reassess the resident the week after or 2 weeks after, you can wait to fill out this form when you see them in 1 or 2 weeks. The only thing is, if you have to fax this form to the MD to sign and get it faxed back, you may not want to wait 2 weeks, because what happens is, if you, let's say they had their visit on December 1st and you're now December 4th. If you're supposed to see the resident on December 10th, you fill out the form, you fax it to the doc. By the time the doc faxes it back to you, you may not have it in time in place in the chart before that 101st visit is billed. So if you have to fax the forms back and forth, it's really important that you see them as soon as possible after that visit date. And what can happen is, if you get their 85th visit was December 1st, it's December 4th, you go see the resident today, they were only due in 2 weeks, well, you've seen them for their quarterly reassessment. You don't have to re-see them in 2 weeks. You can just bump their quarterly assessment up a little bit so that this counts as their quarterly assessment as well. Okay? What we have, there is a report for retirement and community homes if you need it. There's a report that can be generated in Coligo that shows when residents have reached their 75th visit, just to give a little bit of extra time for planning for physios who are going in maybe only once every 2 weeks to some of the smaller homes. If you need that extra notice, let support office know and we can make arrangements for that report. Okay? So back to the tracking sheet. So the PTA has written the date that the resident had their 85th visit. Now, once the 85th visit assessment is done and this form is filled out, we're going to document the date that the 85th visit reevaluation was done. And if we're using a previous date, that's okay. You can, if you're writing December 1st was their 85th visit, but you're using their quarterly assessment from November 24th, you can write November 24th here. That way we know you're referring to a previous assessment.